Last week, as you all know, Bernie Sanders finally unveiled his highly anticipated Medicare for All bill, and it actually immediately received quite a bit of support among Senate Democrats. Actually, 16 co-sponsors to be exact. So I'm going to let Bernie Sanders go ahead and explain who has decided to come on board with his Medicare for All plan.
As of today, we now have 16 co-sponsors on this legislation. Pat Leahy, Sheldon Whitehouse, Tom Udall, Jean Shaheen, Jeff Merkley, Al Franken, Kirsten Gillibrand, Dick Blumenthal, Brian Schatz, Tammy Baldwin, Elizabeth Warren, Martin Heinrich, Mazie Hirono, Senator Ed Markey, Cory Booker, and Senator Harris of California. And we also have dozens of grassroots organizations all across America who are going to help us pass this bill.
Now, that to me is really encouraging, and it's honestly pretty surprising to me because I didn't initially expect probably more than 5 co-sponsors, but to see 16 Democrats lining up behind Bernie Sanders here, it really shows that as progressives, we really are making a difference. Now, of course, if you noticed that a lot of people who decided to back his bill are also eyeing the White House in 2020, well, you're not alone. But regardless of their true intentions, support for this bill among corporate Democrats like Cory Booker, Kamala Harris, and Kirsten Gillibrand, it still demonstrates the level of influence that progressives actually have, because even if centrist corporate Democrats are only supporting this bill in order to help improve their chances in 2020, well, I mean, this is still a tacit admission by them that they know how powerful progressives are. And to me, I feel as though that's a win in and of itself. So progressives are making progress, we're making our voices heard, and if you are one of the individuals that's been pushing for this bill, either via Twitter or Facebook, I mean, you have yourself to thank for moving the party in this direction. Now, we've still got a lot of work to do, and, you know, the fight is only beginning, but I still think this is really great. Now, regardless, I mean, I don't want to harp on corporate Democrats too much here because they're still doing the right thing, and even if I may not necessarily know whether or not they're doing this for altruistic reasons, there was one individual that really, you know, restored my faith in her, at least to some extent, and that is Elizabeth Warren, who spoke about this bill and gave a really passionate speech that was honestly really moving to me.
It's an enormous honor to stand with each of you to say never again in America does anyone go bankrupt just because they got sick. Never. This has been a long fight, from Franklin Roosevelt, who wanted health care for all as part of Social Security, to Lyndon Johnson, who gave us both Medicare and Medicaid, to Ted Kennedy, who made sure that our children were insured with CHIP, and to Barack Obama, who helped build the game changer that gave millions of Americans who didn't have health care coverage new health care coverage. We are here today to take another step. We will not back down in our protection of the Affordable Care Act. We will defend it at every turn. But we will go further, and we will say that in this country, everyone gets a right to basic health care. That's what Medicare for All is all about, and that's why we're here. I want to say thank you to Bernie for all that you have done. I am honored to be part of this fight. I am honored to have a chance to stand up and say one more time, healthcare is a basic human right, and we fight for basic human rights. Thank you all.
Now, that video actually made me emotional, and it's not because, you know, I feel as though my love for Elizabeth Warren is back again or anything like that. And yes, I know that I'm a sucker for sad music and a cleverly edited video that clearly tried to invoke an emotional response out of me, but I think that this video really put things into perspective, and I think Elizabeth Warren gave a great speech. This video really demonstrated to me that this is the moment in history that we'll always look back on, where Bernie Sanders introduced the bill that would one day become law and make medical bankruptcies and deaths due to a lack of insurance a thing of the past. And when we read about this day in history books, which I believe we will one day, future generations are going to ask the question, what the hell took you guys so long? And all of us will be there to tell them how we fought, how you fought for this bill relentlessly. But Elizabeth Warren wasn't the only show stealer here, because Bernie Sanders brought out a Canadian doctor that made a really powerful speech that showed us exactly what we were missing by not having Medicare for all here in America.
I must say I'm very grateful that so many Americans are interested in learning about the experience of your Canadian neighbors under our single-payer healthcare system, which we also call Medicare. As a practicing doctor, a hospital administrator, and a citizen, I am so proud to be part of a system where access to doctor and hospital services is truly based on need, not ability to pay. And I'm not the only one. In public polls, 94% of Canadians say that our healthcare system is a source of personal and collective pride, even more than ice hockey. Single-payer healthcare is a symbol to us of what it truly means to be Canadian, that we take care of each other. Now, my grandparents immigrated to Canada in the early 1950s, like so many people who come to this country, hoping to build a better life for their kids. And at that time, there was no universal health coverage in Canada. So when my grandfather had his first heart attack in his early 40s, his world was shaken. And by the time he died nearly a decade later, the family was essentially bankrupted by medical bills. I know that this remains a reality for many in the United States today, but you should know that just north of your border, that kind of a situation is essentially unimaginable. My generation of Canadians does not remember what it was like to worry about paying a doctor or a hospital bill. And despite our challenges, which of course every country experiences, Canadians have a longer life expectancy, lower infant mortality rates, and fewer preventable deaths than in the United States. Single-payer healthcare is also, as you know, less expensive. In Canada, our administrative overhead is less than 2% in our public plans, as compared to 18% in the private plans here in the US. We spend just under $5,000 per capita in Canada to cover everyone. You spend nearly $10,000 per capita, and yet tens of millions of people are uninsured. But most importantly, when my patients are sick, I do not need to ask if they have insurance or if they can afford to pay for my services. And throughout my pregnancy, and for the birth of my daughter in a world-class hospital, I was never asked for money, and I never received a bill. I just handed over this card, my Canadian healthcare card, to my doctor, and that was it. I wish that all of my American neighbors could experience the same simplicity in their moments of need. And I hope that the American people will seize this opportunity to declare to each other and to the rest of the world that you do believe access to health care is a human right. Thank you.
Great job.
So I think that her message was especially important because as humans, we're hardwired to fear the unknown. But the thing about Medicare for All is that it's not unknown. I mean, single payer is not a new idea. It's actually something that exists in the world today. I mean, you could look to other countries, just our neighbor north of the border in Canada, and see that single payer is something that all of their citizens love and they take pride in. So, you know, this was really important to hear from that outsider's perspective to let us know that we don't have to be worried about something that's unfamiliar to us because other people, just our neighbors, they have it and they love it. And yes, by moving towards a Medicare for All system, we are making the right decision. Now, when it comes to the 16 co-sponsors, getting back to them, yes, irrespective of their true intentions, what they're doing is the right thing. But there's still quite a bit of Democrats that are not supporting Bernie Sanders' bill. I mean, 16 is a lot and more than I expected, honestly. But we need 100% of Senate Democrats to be on board with this bill. So the first question that we have to ask is where the Democratic Party's leadership stands. And they've made it clear that they are against this, even though they don't want to tell us that they're explicitly against it. So Nancy Pelosi doesn't support single payer because, quote, right now I'm protecting the Affordable Care Act. And Steny Hoyer, who is next in line to become the Democratic Party leader in the House, echoed the same sentiment by saying, the first objective that both Leader Pelosi and I have is to preserve the ACA and to adopt policies that will make it work better. That's our first priority. So according to Nancy Pelosi and Steny Hoyer, we can't walk and chew gum at the same time, but at least that's a somewhat coherent response, at least when juxtaposed with Chuck Schumer's response, because, I mean, he brushed off single payer altogether, saying, quote, Democrats believe that healthcare is a right for all, and there are many different bills out there. Well, actually, it's not a right if you don't guarantee it. So you don't get to co-opt our rhetoric and then not walk the walk. If you're going to say that healthcare is a right, then treat it like a right and co-sponsor Bernie Sanders' bill. But Chuck Schumer won't do that. And furthermore, he talks about how there's many bills out there. He said this before too, but he hasn't proposed a single alternative to single payer. And also, his constituents are asking him to support single payer, so he needs to do that. And of course, if you're a rational thinker, then the arguments from Steny Hoyer, Nancy Pelosi, Chuck Schumer, they make no sense. And if you want to know why they're saying the things that they're saying, even if they don't make sense, well, you just have to follow the money for an answer. So in fact, Andrew Perez is a journalist that did just that. And he reports that Democratic holdouts on Medicare for All have received twice as much insurance industry cash as sponsors. So when you look at the specific numbers, we see Gary Peters, Ron Wyden, who's my senator, Chuck Schumer, Mark Warner, Debbie Stabenow, Bob Casey, Patty Murray, Michael Bennett, Bill Nelson, and Dick Durbin all receiving the most cash in comparison with their colleagues. And if you're wondering whether or not this really is just a cut and dry case of pay to play, it is, but we actually have an example that illustrates perfectly how money from the health insurance industry influences Democratic Party members' actions. So we'll take John Hickenlooper, for example. So he actually isn't a member of the Senate. He's currently the Democratic governor of Colorado. So he's someone who identifies as a so-called moderate that doesn't support single payer. And now that he sees the momentum clearly shifting towards single payer, he's not only doing what his donors paid him to do and fight against single payer, but he's really going above and beyond. So according to David Sirota and Lydia O'Neill of the International Business Times, Colorado Governor John Hickenlooper, who is leading the push for an insurer-friendly alternative to Bernie Sanders' Medicare for All proposal, has hired a Washington lobbying firm that represents insurers and other healthcare industry companies and groups opposed to single-payer healthcare. The firm was hired by Hickenlooper's government office to lobby on healthcare after it helped bankroll the Democratic governor's election campaign. So this example demonstrates just how important campaign contributions from the health insurance industry are to Democrats, because it's not just like he is creating an obstacle to single payer. He's taken it upon himself to stop momentum at the national level when it comes to single payer, because he thinks that for whatever reason, if he loses those health insurance industry donations, that it would hurt his electoral prospects when he runs for governor again or potentially runs for president. So this is the level of corruption that we're dealing with. But the thing about corruption is that we can combat it, and that's where you come in. So at this point, the fight's only beginning, and even though we already have 16 co-sponsors, we've got to do for this bill what we did for H.R. 676, which is the companion bill for Bernie Sanders' Medicare for All bill in the House. So that's exactly what we're going to do. So since one of my senators, Ron Wyden, is not on board with Medicare for All, I'm going to call him and ask him exactly why he's choosing to not co-sponsor this bill that his constituents in Oregon clearly want him to back. So I would encourage you to call your senator, but Ron Wyden's number, for those of us that live in Oregon, is 202-224-5244.
Hello, this is Oregon Senator Ron Wyden, and it is an honor to represent you in Washington, D.C.
Then why aren't you representing me?
Thank you for calling to make your voice heard. At this unique time in our history, it's crucial you let me know your concerns.
I will.
Now one of our staff will tell you how to leave a message.
If you'd like to leave a message or comment on an issue, please press 1. If you'd like to hear office hours and location, please make sure to spell your first and last name and provide your Oregon zip code before leaving a message. You may also leave your full mailing address if you'd like.
Hello, this message is for Senator Ron Wyden from one of his constituents. My name is Mike Figueredo, Figueredo, in zip code 97203. And I'm calling to ask Senator Wyden why he's not representing me as one of his constituents, because Bernie Sanders, as you all know, recently introduced his Medicare for All bill. It is S1804. And for some reason, Ron Wyden hasn't co-sponsored this bill. So my question is, why haven't you done what Oregonians clearly want you to do? And my second question is whether or not the $148,000 had anything to do with your unwillingness to not support this bill. So I voted for you twice because sometimes you do some really progressive things. You've done also really problematic things. You voted to fast track the TPP, but I tried to look past that and voted for you anyway because, again, you've done great things in the past. But if you do not back this bill and co-sponsor this bill, I promise you, I will never vote for you ever again. You will not dupe me over again. I voted for you in 2010 and 2016, and that will be the last time if you don't get on board with this bill. So not only do you need to co-sponsor this, but you need to actually actively fight for it. Otherwise, you've lost my support forever because this is the ultimate litmus test. And again, if you don't get on board, you've lost one supporter forever. Co-sponsor this bill, stop being a coward and do what's right. Ignore your health industry donors because they're not the ones that vote for you. We are, and I voted for you. Now you need to represent my interests because that's what you do in a democracy. We elect you to represent our interests. Now represent us. Sorry, I kind of got a little bit more angry at the end there, but I kind of just go off sometimes. So again, you don't have to leave them a 10-minute message like I typically do, but I start off relatively calm and then I get angry, as you guys all see. But please call your senator. Let him or her know that this is non-negotiable. If they don't get on board with Medicare for All, you're not going to be on board with their election campaign. And I want to kind of shine the spotlight on Sherrod Brown because he is a so-called progressive senator and he's nowhere to be found on this issue. So call your senator. And if for whatever reason you have both of your senators on board, then call Sherrod Brown because he's someone who I think we can get on board if enough people call him. So, that's what it comes down to. The fight is only beginning. We are hitting the ground running, but, this is only the beginning. So pace yourself.
Support this podcast by becoming a patron at patreon.com/Humanist Report.